The pituitary gland is a small gland that branches off the inferior portion of the hypothalamus. It is connected to the hypothalamus by the pituitary stalk, which is a tube made of blood vessels and nerves. The pituitary gland is also known as the master gland because it controls the release of hormones from other endocrine glands. The hypothalamus tells the pituitary gland when to make hormones that are needed in other areas of the body, and these hormones are released directly into the bloodstream. The pituitary gland is divided into two major lobes, the anterior and posterior lobes, with an intermediate lobe connecting the two. The anterior lobe secretes most of the pituitary gland hormones, such as adrenocorticotropic hormone, follicle-stimulating hormone, growth hormone, luteinizing hormone, prolactin, and thyroid-stimulating hormone. The posterior lobe only secretes two hormones, antidiuretic hormone and oxytocin. These hormones are made by the hypothalamus but stored and released by the posterior lobe. Adrenocorticotropic hormone, which is released by the anterior lobe, stimulates the production of cortisol, which is your stress hormone, within your adrenal glands. It also helps maintain blood pressure, as well as regulate metabolism and blood sugar and reduce inflammation. The pituitary stimulates the production of cortisol within the adrenal glands. Cortisol influences inflammation, metabolism, blood pressure, blood sugar, and heart rate.
The anterior lobe also makes and releases follicle-stimulating hormone. This stimulates the sperm production within the testes. When FSH is reduced, this affects the number of sperm produced. The pituitary gland also releases luteinizing hormone to stimulate the production of testosterone. If there is a reduction of LH, this affects the production of testosterone. FSH also helps with estrogen production and egg development. When the pituitary detects low levels of estrogen, it secretes FSH and LH to stimulate the growth of ovarian follicles that contain eggs. As estrogen levels rise, the pituitary stops secreting FSH and all but one follicle are starved of FSH. Whilst estrogen levels are high, the pituitary releases LH, which triggers the maturation of the egg. The anterior lobe also releases the growth hormone, which helps stimulate growth within children, impacts metabolism, and keeps adults healthy. Prolactin is also released from the anterior lobe, which stimulates the production of breast milk. The last hormone released from the anterior lobe is the thyroid-stimulating hormone. This hormone tells the thyroid to make and release thyroxine, also known as T4, and triiodothyronine, which is T3. These help manage metabolism, energy levels, and the nervous system. The posterior lobe stores and releases antidiuretic hormone and oxytocin. ADH helps the regulation of sodium and water levels within the body. Oxytocin signals the uterus to contract and helps the baby bond to the mother.
New research is currently being conducted for new medication to treat acromegaly. Acromegaly, also known as gigantism, is a disorder in adults in which the pituitary gland produces too much growth hormone. The first oral medication is being used as treatment that works at the pituitary level to affect different receptors. A pituitary injury called post-traumatic hypopituitarism is a result of a traumatic brain injury. PTHP can affect the body's ability to produce hormones and can result in changes in body composition, metabolic dysfunction, reduced bone density, and decreased quality of life. Sport-induced hypopituitarism is caused by repeated mild head injuries over the span of an athlete's career. This is prevalent in football players and boxers. Blast-related hypopituitarism is caused by blast exposure. This can be seen in members of the military. Physical therapists can treat the symptoms caused by pituitary abnormalities. Some of these symptoms include muscle weakness and joint pain. Physical therapists can identify problems to address during their initial evaluation and then treat patients using manual therapies, exercise, ultrasound, electrical stimulation, and more.